Okay.
They don't want to say overdose. They want you to say a breathing emergency or a bad reaction.
Well,
I don't know.
Bad reaction sort of makes me go, well, duh. This guy just shot up a syringe full of heroin. He's having a bad reaction. Duh.
Hey guys, you are on the 14th Step. It's a podcast about addiction and recovery. My name is Mark. I am a professional counselor and a recovering addict.
My name is Skip. I am a recovery coach and a recovering addict.
I don't know if we can say that.
Who put
anymore.
a question mark on the teleprompter?
Person in long-term recovery from substance use disorder.
Oh,
if that's not cringy, I don't know what is.
Well, you bring up a good point. We're changing the way we speak about recovery, aren't we?
Well,
is that what we're doing?
There's a push to do it.
There is?
And it has there's a noble cause to it.
Yes.
And it's coming from these organizations that are trying to push for policy change.
Mm-hmm.
That's their agenda.
And that's a good thing.
So they're kind of like lobbying. Well, I guess it's good depending on what they're pushing for.
True.
And what the goal is to try and change the language that we use about recovery and addiction to try and reduce stigma.
That's it. It's all about destigmatizing.
And so the words that we are discouraged from using when we are talking to, I guess, an audience. I mean, I don't know. What kind of audience are we talking to here when we're using these terms? Like the Rotary Club?
What?
Or like Thanksgiving?
The high school anchor club? No.
The legislator?
I was in a symposium conference this week in San Antonio about Texas substance abuse symposium. I think that's what it was called. SUS, something like that.
That is sus.
Can't use that word anymore. But it was very interesting because it was really good. It was talking about destigmatizing from the medical profession and talking about dealing with patients as far as doctors, talking to other doctors, referrals, insurance, especially emergency room protocols, this sort of thing is destigmatizing to treat it more like it's a regular medical condition and not a moral failure. That's the big argument, right? We've talked about moral failures before. Yeah. So what are some of the words that they're changing to on charts, I guess, when they write charts, or they're passing along information, this or that?
Well, one of the main words is addict.
Uh-huh.
The other one is drug abuser. These are stigmatizing words.
Mm-hmm. Junkie.
Mm-hmm. And I could see if there was a doctor talking to his patient and saying, well, you're just a junkie.
That would be horrible.
That's ugly.
I can't even, I don't even see that happening. But
maybe it has.
Maybe a addict. But that's verbiage still used in 12-step meetings.
I don't call anyone an addict, though.
You don't.
I will identify myself as an addict because I think that's helpful to other people, and it's also helpful to me to identify as an addict.
Okay.
I would not identify myself as a person with a substance use disorder to anyone.
Okay.
Because I don't think that's particularly helpful.
You know how you introduce yourself at a meeting, you say, hey, I'm Skip, I'm an addict?
Yes.
There are people now that refuse to say that.
Yeah, I know.
In some of the training I did, they say, hi, my name's Skip. I'm in recovery.
Right.
That's what they say.
So some other words that they say are stigmatizing are relapse. And so they want you to say recurrence of use.
Okay.
They don't want you to say medication-assisted treatment, which would be methadone, Suboxone, and kratom for some people, which we can talk about.
Okay.
They don't want to say overdose. They want you to say a breathing emergency or a bad reaction.
Well,
I don't know.
Bad reaction sort of makes me go, well, duh. This guy just shot up a syringe full of heroin. He's having a bad reaction. Duh.
He's having he's a person with a breathing emergency.
I'll bring up a comedy routine on here. Is when a serial killer kills more than one person, when there's more than one, they call it special circumstances. This is a Jerry Seinfeld joke. Special circumstances is when I go to buy a coat from a suit shop and they go, we have 42 long, we have these sizes, but in your case, special circumstances. Not when you kill more than 3 people.
Some of this language is, to me, it's so crazy.
Okay.
I don't really know.
Bad reaction.
I think that there's probably some good intentions with it.
Absolutely. From the guy I talked to, it was all very good intention.
But I don't know if it's misguided or not. And so the other one says clean or dirty. I can speak to this because I do drug screens with my clients all the time. So I pull a client back. I will give him or have a female counselor give her a drug screen, and then I'm taking that client back to my office and we're going over the results.
Okay.
So obviously this is a stressful situation for the person that's sitting across my desk.
Sure.
I don't say it's clean or it's dirty, because I just feel like it's kind of a delicate situation anyway, and I think it's more respectful to say, well, it's a positive result or it's a negative result.
Okay.
It just feels better. So I do get that some language might feel better than other kind of language if you're trying to preserve the dignity of a person and reduce stigma.
Is it just more professionalism, you think?
I think so. And I think because if I'm coming at a person from a professional standpoint, reading them, oh, well, you're dirty for this, you're dirty for that, shame on you.
That seems street.
Yeah.
It's kind of street, right?
It is. And
like
so
I know about that.
I would rather keep it more professional. And also I want to be very careful about how I relay that information, because I want the person to keep coming back.
Yes.
And I don't want to be off-putting in that situation.
Well, and maybe in their mind, because I've seen plenty of videos where you have recovery coaches and you have counselors that are very street, the way they talk in lingo. And I think for some people it makes them, it's like they use I'm down at their level because I've had lived experience and I'm going to meet them where they are. Yes, I understand part of that, but I think if somebody's at that point where they're coming into recovery, like inpatient or outpatient, wouldn't you think they would want something different at that point in time, maybe being treated? I don't know. It's a really interesting question. I'd love to hear some people's feedback on that.
There's some kind of fear that the word addict is offensive to people.
Mm-hmm.
Well, addiction is kind of an offensive thing to begin with. I don't think we can really scrub it clean to where people's feelings aren't hurt all the time. That's kind of the other side of it. If I'm like a junkie, I'm shooting heroin all day, and I go to a meeting for the first time, and the person chairing the meeting is like, I'm a person in long-term recovery from substance use disorder. Like, that guy came out of a book, and I don't really want to listen to that guy. If I'm in a meeting and the person says, I'm Skip and I'm an addict, I can relate to that person.
Mm-hmm.
So for the language that I use, I try to use for the benefit of newcomers.
Gotcha.
Because I think it carries a more effective message to someone who's coming in for me to say I'm an addict. And it also deflates the word because I'm using it. And I'm not stigmatizing myself.
Right.
So it kind of takes the power out of the word more so than trying to change the language from the top down through policy initiatives.
So maybe it really a lot depends on your audience.
It does. Such a non-answer, just like everything I say.
No, it's a good answer.
It depends.
It depends on who you're talking to.
I will identify myself as an addict. I will not identify another person as an addict.
Gotcha.
So that's where I stand. What do you guys think about the word addict, junkie, relapse? Leave us a comment. Tell us what you think. If you are in recovery, do you refer to yourself as an addict? We would like to know that.
Absolutely. Please comment, like, subscribe, all of it.
Please like and subscribe.
Please.
Especially.
Yep.
We're hungry. We haven't left the studio in a week.
That's right.
And we've only made this video.
I'm in the same shirt. I'm kidding. All right.